Thank you, Madam Chair. You know, almost 50 years ago, America established an important public policy through Title X that birth control and contraceptives and family planning should be just as available to working class and uninsured women as they are to every other woman across the country. And despite all of the progress we've made and all of the new modern types of birth control that have become available, many women and families still struggle with access to contraceptives, preconception care, and vital health screenings. Now, the Trump administration wants to pass a rule that takes America backwards, that de-emphasizes contraceptives and birth control, promotes abstinence and the rhythm method. This is something of a battle we fought 50 years ago, isn't it? And what strikes me is that it's clear that this Trump administration proposed rule is going to increase the number of unintended pregnancies. And don't just take it from me, that's what all of our trusted health groups have said. The American Medical Association, the American College of Obstetricians and Gynecologists, the American Public Health Association. Why are they wrong, Dr. Foley?
I disagree with the premise that this new regulation is going to not emphasize contraception and emphasize other methods that are more important. That is not what it says.
See, America is always at its best when we base policy on science. And Title X, that is particularly true for Title X, because it's always been seen as the gold standard for family planning care in this country, based on the best standards of care. Now this proposed rule is going to change that. Since the year 2000, Title X regulations have stated that services are going to be a broad range of acceptable and effective medically approved family planning methods and services, including natural family planning, right? That's what the regulations have said.
The current regulation states that.
So your final rule now would remove the requirement that methods of family planning include those that are, quote, medically approved. Instead, the rule emphasizes the provision of natural family planning over other methods. Now, America's College of Obstetricians and Gynecologists have said about that, this modification appears to be diluting long-standing Title X program requirements, lowering the standards governing the services that must be offered. These changes threaten the quality of family planning available to Title X patients. Now, don't just take it for those experts. The American Academy of Family Physicians advised you that in removing medically approved from current requirements, the rule, quote, allows Title X grantees to exclude certain forms of FDA-approved contraceptives, restricting access to safe and effective contraception. Did you look at how many more unintended pregnancies will result from this rule?
I would disagree with the premise that medically approved is an issue.
Can you answer directly? Did you examine how many more unintended pregnancies will result because of the change in policy? Yes or no?
In the estimation of that, there would not be a change based on any changes made to the rule.
Well, why do you disagree with all of the, I mean, who are you going to trust out there? America's obstetricians and gynecologists, the AMA, the American Family Physicians? They're the ones that have said that this rule will lead to negative health outcomes. It will lead to more unintended pregnancies. That's unfortunately going to be the result when you have less contraceptive services, medically approved, that are available to women and families across the country. You have elevated ideology over evidence in the public health, and you've done so to the detriment of women and families. And I yield back at this time.